Hi, everybody. Welcome back to Beyond the Diploma. I'm Catherine. I'm editor and producer of the podcast, and I'm here with the hosts Emerson Sprinkle and Avery Park.
Yes, today we have a very exciting interview for you all. We have Dr. Tabar, who is a radiologist. So we finally have an episode in the medical sector. Specifically, I thought radiology would be cool for this interview because, or we're interviewing a radiologist would be more interesting. Not more interesting, but I feel like we have so many we know so much about like surgeons and then our like regular like primary physicians, whether it's through like the media or just I feel like generally there's more of a focus on being in the surgery sector. I feel like when people say they want to be a doctor, you typically hear that they want to be something regarding surgery, but again, no shade to radiology. Of course, it was very interesting. Again, which is my like long-winded way of saying I really felt like I learned a lot, and so selfishly, I really enjoyed this interview. Yeah.
No, yeah, I completely agree. I think I went into this not really realizing the full extent of what radiologists do. But also, as Avery said, I feel like you hear a lot about, like general practitioners and you hear a lot about surgeons and things like that. Being completely honest, I didn't realize that radiologists like had to do the full 4 years of med school. Like I thought that it was like the same training that like sonographers get and things like that. And so it was really interesting to talk to him and just be like, okay, you made it through med school. Like, what was the decision that made you decide, like, oh, I want to do radiology as opposed to other things? Because a lot of time you talk to people and they're like, oh, I went into med school knowing I wanted to be a surgeon. And then they usually come out being, their specialties change, but usually they come out like knowing exactly what they want to do. So I just think that was really cool to hear about kind of how he got there.
I think it was also very helpful to have him like to hear him talk about not also like his decisions of how he got there, but what he did to get there. I feel like the advice that he gave us was basically, these this period of time, it's a time where you should be focused. I mean, you should have fun and you should live in the moment, but he said like you should feel confident in your decision to stay home and study and make sure you get those good grades, especially if you want to go into an area with medicine. The only way it's going to happen is if you take it seriously, like taking your future seriously. Like it's okay not to go to every party. I mean, obviously he was like, have fun, but I think it was just reassuring to have someone saying, it is important to take things seriously, which is like obviously, but it just again, it felt like reassuring that you won't feel like you missed out. You'll feel like okay with your decision to maybe opt out of not going to every social event, even though you want to be, part of the community as much as possible, but having that balance and really putting you and yourself and your future first.
No, yeah.
Yeah, I feel like, oh, wait, sorry, Kat, you can
That's okay.
go.
No, I was just gonna say, I feel like he gave a very comforting viewpoint, especially because it's such like a stressful job and like transition into like your actual role. Um, his outlook on it and how he like navigates the stress of the job and stuff, I feel like, especially for me, because I want to go pre-med, was very comforting and like it's okay.
Right.
Like I'll get there
Yeah,
at one
Yeah.
point.
especially because oh no, you go.
Yeah. Well, I was gonna say I really appreciated too, kind of along the same lines as what Catherine was saying, how he really loves his job, and he was kind of emphasizing that if you're gonna go into medicine, it should be something you love, because obviously it is. It's like a big, it's a large commitment. Obviously, it's like many, many years of your life. And I think there's a lot of pressure. Obviously, he is a doctor, but there's a lot of pressure to kind of be, a doctor or a lawyer. Shout out me and Catherine. But I think the overall, Avery, what are you going to be, an economist?
Uh, I was wondering.
Who knows yet?
Keep on going. Keep on going. Sorry, I didn't mean to interrupt.
So I guess the overall point there was too is, don't just pick something because you think that's what's going to make you successful or make you a lot of money. Obviously he is a doctor, but he clearly loves what he does. And so I think that's kind of a very important message, is just make sure whatever you're committing to is something that you're going to enjoy.
Right. Obviously to go off of that, he talked about, medicine. It gives you a very financially successful lifestyle, but like he said, like you only get that if you're very committed and passionate about what you do. Like the money won't come because then you won't, like it is a long journey, and if you sign up for it, like you will be okay. But also, take it seriously. I like that he had like both like balance. Just make sure like if you're gonna do this, you gotta commit and then it'll be okay. So yeah.
I was gonna say another thing that you just said that reminded me of that was that I feel like a lot of people think that, especially doctors, or people working in like higher medicine and things like that, think that like that is your entire life. And it was really refreshing to say that like his favorite part of the day is like coming home, being able to see his family and all that. Like he very clearly has a decent balance, which is like comforting to know.
Right. And there's also just so much that if you want to go into medicine, there's so many things that you can do, whether you want to be more involved with your patients or be less involved with your patients. I think it was just nice to hear. Obviously, like all of our episodes are like an inside person, I guess, experience, but this one was very insightful, I felt. I think it was, again, like very comforting and yeah, I mean, I really enjoyed it, even though I don't think I'll be going into medicine, but I think, again, like all of our episodes, I really enjoy that our speakers, they give advice that definitely transcend the field that they're in. So,
Yeah, I
if
completely
there's
agree.
no further comments, I say let's get into it.
Let's get into it.
Hi, welcome back to Beyond the Diploma. My name is Avery Park, and I'm here with my co-host Emerson Sprinkle, and we have our very special guest today here, Dr. Tabar. So why don't you introduce yourself?
How are you guys? My name is Saam Tabar. I'm an interventional radiologist, and I'm excited to be here today.
Thank you so much. We're so excited to have you. So our first question is for people who don't really know what you do, could you kind of like describe your day-to-day routine as a radiologist?
Yeah, absolutely. So, in radiology, it's kind of like split up. There's like kind of two subsets. There's a diagnostic portion where we read CAT scans, ultrasounds, X-rays, mammograms, things like that. And then there's the interventional radiology side where we basically use the image guidance, like the CAT scan and the ultrasound and X-ray to basically guide ourselves and do like minor procedures essentially. The procedures could be major, but they're basically minimally invasive. So you're not really cutting people open. You're using small needles, wires, catheters. So kind of how I'm set up is essentially maybe like 50% of the time I'm either in the hospital or at home reading CAT scans and X-rays, and then the other 50% of the time I'm doing these procedures. And then we take call, because where we work, it's a trauma center. So, there's always chance that a trauma could happen overnight or an emergency, on the weekend that we get called in for. That's not the exciting part of the job because you never want to get called when you're chilling at home with the family. But that's pretty much it in a nutshell. It's pretty cool specialty in medicine.
Yes, that's a perfect transition into our next question. So we just wanted to ask why radiology? What really like attracted you to the field?
I mean, growing up, I mean, I always liked computers, because I was born in 1981. So it's kind of, as I was growing up, that's when computers were coming into vogue, and I love technology. But being from a Persian family, they always stress, oh, you have to be a doctor. So, it's like, luckily, I like the math and sciences. So it was an easy transition for me. So, I was thinking, okay, well, I want to make my parents proud, but I also like the material. So why not go into medicine? It's going to give me a comfortable lifestyle, and I'll be respected. So I thought it'd be a great career decision. So then when you're in medical school, you basically take your basic sciences the first 2 years, and then your third year you do your rotations. Some core rotations like medicine, surgery, pediatrics, OBGYN. Kind of like psychiatry, things like that. And then in your fourth year, you can take electives. And one of the electives I took was radiology. Because when you're rotating through all these things, obviously radiology is part of everything. Because every patient at some point needs some sort of imaging study, or some sort of image guided procedure. So I was seeing all this, as a third year medical student. And then, as a fourth year, I decided to do some rotations in radiology and interventional radiology. And I was like, oh, this kind of puts the two things I really like together, the technological aspect of things, which I really love technology. I'm a tech nerd. And then, the patient care. So that all kind of came together. At first, I was like, okay, well, should I do diagnostic or should I do interventional? But diagnostic to me gets a little bit mundane if you're just kind of doing the same thing behind a computer all day, just looking at CAT scans and X-rays. To me personally, it becomes a little bit boring. I do like it kind of mixed in, but if that's all I did, I think I would get bored. So kind of the procedural aspect is nice because, I interact with patients, we do life-saving procedures. I interact with the staff. Like the staff we work with right now is just like amazing. They're like family to me. So it's the best of, every aspect. So I got really lucky.
That's so great. I feel like that's kind of really great story. And that was kind of one of our questions was, did you go into med school like knowing that that was one you wanted to do? But also, I guess this whole podcast is about, speaking to people and kind of gaining mentors and things like that. So did you have any sort of like mentor in college or med school that really like helped shaped you?
Well, growing up, I had a cousin of mine who I'm still fairly close with. He was about 5 years older than me. And, he was always wanting to go into medicine. So he basically did everything before I did it and kind of guided me through the whole process, which I got really lucky to even have that because a lot of people don't have something like that. So, it's like when, after like high school, when trying to figure out where to go to college, he's fairly smart and practical about things. He was like wise beyond his years. He's like, look, you want to go to medical school. The way to get into medical school is you have to get good grades in college and do good on the MCATs. It doesn't necessarily matter what college you go to. So try to go to, a college that's going to lower your costs. So I went to George Mason University. Back then it was very affordable. Now I think it's like $25,000 a year, but when I went, I think it was only like $4,000. I graduated in 2001 from college. So, I went to college, and I lived at home, kind of geeky move, but I mean, I thought it was nice because, I could save money. My mom and dad were there to kind of help me with everything I needed. There was always food on the table. Cut into my partying life, but maybe that's a good thing so I could focus on my studies because, you always have time to party in the future. You just got to get down what you're going to do to establish yourself. So, so that was pretty much it. He kind of guided me in that regard. He kind of helped me out. He also went to George Mason, graduated before I got there. So he kind of guided me through which classes to take and kind of how to stack your schedule. So it was great. I mean, just having him was a big help. And then, then you do good and you study for your MCATs. You got to get a good MCAT score and then you apply to med school. You go do your interviews and luckily I got in. It was great.
Yes, that sounds very interesting. I know one of the biggest things about people who want to go into the medical field is like you're talking about, it's a very long road to actually becoming an established like doctor or surgeon or whatever they decide to pursue.
Yeah,
Do you
absolutely.
yeah, like
Yeah.
advice about that? I know I'm sure it gets like very hard. And did you ever have any, I guess, doubts and how did you like stick with it and keep going?
Well, one thing you really have to enjoy it. You can't be one of those things where it's like you're being pushed in. Like, I mean, my family was trying to push me into it, but I did enjoy it. So, but I had a lot of friends, because, there's a big Persian population in Northern Virginia where I kind of grew up. So a lot of them were also getting pushed in by their parents, but they just hated the sciences. So they would, take their biologies, their chemistries, and they would just do horribly in those classes. So now you're basically wasting time and money because if you're not getting good grades, you're not going to get into med school. I mean, it's as simple as that. Although you could potentially go to the Caribbean, which is easier to get in, but then it's kind of harder to get into a residency that you want. But there are always roads to kind of do it. But if you want to stay in the United States, you really got to get good grades in high school. So you have to enjoy the material. And then you have to be willing to, study. You're not always going to be able to make it to every event with your friends. You're going to have to say sometimes, hey, look, I got a test to study for. I can't make it. You have to be fairly disciplined, but there's room to have fun. I mean, I enjoyed my entire college and med school career. As a matter of fact, med school was probably the best 4 years of my life because that was the first time I moved away from home. So that was like the first time I felt independent, made all these new friends, and you're with a group of people that are basically doing the exact same thing with you. We had 180 students in our class, so all 180 are basically taking the same class together, going through the same process. So you build great friendships. So it was a great time. I never had any doubts or anything like that. But we did have a few people in our med school that, they made it, but they didn't enjoy it and they just dropped out after the first year. And we had some people that, they wanted to continue, but they were just not disciplined enough. They made it into med school, but once they got in, they weren't, putting in the time and the effort. So, there's always a chance you could fail out. It's a low risk of that happening, but anything's possible. But yeah, I never had any regrets. It was pretty much smooth sailing, and I enjoyed every second of it.
That's so great. Like, I feel like obviously it's so nice to hear that you had a good experience in med school, but kind of
Absolutely.
now in your career, can you talk about like what's the most rewarding part of your job?
Well, I mean, it's great because I'm part of the interventional side. So, we treat patients and we can kind of see changes in them as we treat them. If someone comes in for a trauma and we're able to stop the bleeding, then that's a great feeling. You can go tell the family you did something, great for the patient. Like I had a patient yesterday. All his veins were clotted off throughout both of his legs, and his legs were like, tree trunks. So we were able to go in there. We were able to suck out all the clot. I was able to use a balloon to open up any areas of narrowing. And this morning, I mean, I wasn't there this morning, but one of our nurse practitioners gave me a call and said, his legs are already looking better. They're very thankful. And it's nice to be able to kind of get that feedback from them. And that's what I like about the kind of the interventional aspect of it, as opposed to the diagnostic aspect of it, where, you'll read a CAT scan, you'll read an X-ray, but you don't really know what happens to that patient after that. But some people they're not really too focused on kind of the patient interaction portion of it. Not everyone likes to talk to people. Not everyone wants to, interact. So, that's the beauty about medicine. There's, so many different fields. If you're a very people person, you have that option. If you're a complete introvert, you have that option. There's so many different specialties in medicine that you can kind of tailor for yourself, that, you can basically have anything you want.
Yeah, and I guess like kind of on the flip side of that, like obviously you have a lot of people depending on you, like you have patients depending on you. So do you feel a lot of pressure working in healthcare?
I can see where some people would feel pressure, but I kind of live by the motto of never worry, just keep going, do what you want to do, and try to be your best at it. I personally don't feel like sitting down and worrying and feeling stress and anxiety is going to help the situation. But I mean, I do have a lot of colleagues that have that anxiety, and I can understand, there's a lot of pressure on you sometimes. The only times I would probably say you feel a little bit more pressure is like if you have a trauma patient and then like, everyone else, like the surgeons that are dealing with the patient are basically standing in the room watching you because they want to see what's going on and then they might have to go to the OR. So then you have like 10 people just staring at you doing your job. That does create a little bit of a, more anxiety than if you're just by yourself and your staff and you're having a good time. But in general, I personally don't feel stressed, but like with any job, obviously there's stresses with it. It just depends on, how you deal with it, how your mental health is, and if you got people to talk to. Like I have a beautiful family. I come home, I can decompress with my wife, I have a new daughter. So, I see her, it puts a smile on my face. So I try to, stay away from the anxiety and feeling stressed.
Right. Speaking about the stress and anxiety in the medical field, we just have to ask your general thoughts and opinions on medical dramatizations. Like, there's so many TV shows out there taking place in a hospital. And also more specifically, I guess, How come there's no Grey's Anatomy for radiology? I feel like we don't see that even within the show itself. So I guess I feel like, in our opinion, there's somewhat of an underrepresentation of radiology. Would you like to see that change? Just general opinions about the medical dramas in general.
I never really kept up with too many of the medical dramas. I mean, I have seen a few episodes of Grey's Anatomy. There's a lot of love stories, things like that. I'm sure that happens in the hospital. I mean, I've never, I did meet my wife in the hospital, so I mean, I guess, but we weren't doing anything in the hospital. Obviously, we met, we went out on a date, this and that. So, I feel like it's more love stories than anything. They do kind of dramatize, in the ER, they're like cracking people's chests open and things like that, which I guess doesn't happen as much. Radiology, I do sometimes see like X-rays in the background, that are flipped upside down, and I would think like the producer of the show or the director would know to get these X-rays in the right orientation. Um, but I mean, I don't mind that radiology is not, that, upfront in these shows. I mean, it is kind of, there's no real drama to it. It's like watching someone read a CAT scan doesn't really add any sort of ratings to a show. So, but I really don't know too much about these shows. I never really kept up with them. It wasn't something I was really interested in. I'm more of a comedy type guy.
No, yeah, that makes total sense. I feel like I wouldn't want to watch a lot of medical shows if that was my job all day.
Yeah.
But do wonder, do you think that maybe that helps bring people to the medical field if they kind of see these jobs and like romanticize them in a way?
I mean, potentially, but again, like as a physician, you're not going to be like, oh man, I love Grey's Anatomy. Now I'm going to go become a doctor. You really have to have passion for the field because there's so much work involved in getting to the point of, practicing as a physician. So, I mean, it could be like a nice, added benefit. It's like, oh, this show really makes me like the hospital setting. But if you don't like the, medicine and the sciences in general, you're not going to make it.
Right. On the other side of, I guess, media and technology, so we live in a evolving technological world. Like you said, you're very into like computers and technology and software. I want to hear your opinion, especially as a radiologist, on what you think, the rise of AI and new technologies that are emerging with that, how that will be, in your opinion, shaping not just medicine, but specifically the future of radiology.
Yeah, that's actually a great question because we're already using AI in radiology. Like for instance, there's different AI modules that we have. Like for for instance, every CAT scan of the brain that gets scanned in our medical system goes through AI software, and then it'll tell you, is there a bleed in the brain or is there not a bleed in the brain? It won't tell you anything other than that. Bleed or no bleed. And if there is a bleed, then it can push that scan to the top of the list. So, we prioritize it. And then we have for different other things, like if you have clots in the lungs, it can tell you, are there clots, are there not clots? Um, and it can tell you, is there a fracture in the neck? You know, and there are a few different things, and then it just tells you that something's there. Obviously, you have to look at it and confirm it. As the technology progresses, I'm sure it's going to get better and better and better and better. I don't know at what point, if ever, patients will be comfortable enough to say, okay, let the computer make all the decision making and keep the human out of it. With these CAT scans and patient population is getting bigger and bigger and bigger, and the CAT scans are getting faster. So it's gotten to the point where I feel like we need the AI to kind of help us read these scans because we can read them faster with AI. So if AI tells me, there's if someone comes in with a trauma scan of a head and cervical spine and AI is already telling me there's no bleed and no fracture, well, when I look at it, I feel like personally I can read it faster. I feel more confident in saying, there's a negative scan, as opposed to if I didn't have AI as kind of a backup, then, I might spend a couple extra minutes just, going through, each slice by slice, which we do anyway, but having that extra set of eyes kind of helps us kind of power through these scans. It's just the volumes are getting so high that we really need the help. But like I said, I don't know when it's going to be where I mean, I can't predict what's going to happen 10 years from now, 20 years from now, but I don't see, 10 years from now, at least a computer doing all the work. We did have this company come in where, because what we do sometimes is we do biopsies using CAT scans, so we can scan a patient, mark a spot on the skin, and then we can, guide a needle down. We guide it like 1 centimeter at a time, take a picture, guide it 1 centimeter at a time, take a picture till we get to our target. So this company brought a robot in that you strap to the patient. Then you scan the area that you want to biopsy with the robot on top of the patient. Then you put a needle in the robot. Now the robot and all the images are all together, and then you tell the robot where in that image you want it to guide the needle, and it would guide the needle basically for you. And basically, we wouldn't have it guided all the way. You go 1 centimeter at a time, take a picture, make sure it's going in the right direction. We never used it on a human. We use it on these phantom models, and then we were going to test it out in the hospital, but for some reason the company went bankrupt. So I don't know what happened. I don't know if there was, if there were disagreements, between the company, the higher ups in the company, but it never came to fruition. But just that proof of concept was there because I saw that it worked, and I saw it worked in a phantom model. So I could see that coming in the future. And then that'll help us. Like, because right now, pretty much it's the doctor doing all the biopsies. But if, you can get it where a robot's helping you, you can get, the nurse practitioners, your help, the people that help you kind of manage all your patients. They can kind of be a part of it too. They can just, be working side by side with the robot doing the biopsies. So, it's a bright future. I'm looking forward to it. Some people are thinking that it's going to take everyone's job. I don't see that happening anytime soon, at least not during the time I'm working. Maybe for you guys might have an issue with it, but while I'm working, I don't think AI is going to take anything over.
Yeah, so what you're saying is it's more right now working as kind of like a helping hand along.
Yeah, absolutely. It's
Yeah.
like basically you're working side by side with it.
Right. Yes, I was gonna ask, I'm sure there's more like ethical concerns. I think you touched on a little bit, I feel like, but there must be like ethical concerns with using AI, especially when you're in healthcare. I mean, not just, I know there's already like ethical concerns out in other fields, especially when you're handling a lot of money, but I'm sure people's lives are valued more than
Oh,
that.
absolutely.
Yeah.
Yeah, and as a patient personally, I wouldn't want just a computer being the one making the call on things. Like I definitely want someone that's been trained in it, having another set of eyes on it at the very least.
Right. And then you also mentioned about how you don't think right now that there's like AI is going to do everything by itself. But do you think that there will be kind of more specific or more new like job opportunities that emerge from using AI in the future? Or do you think it'll still be under the umbrella of what radiologists already do?
I mean, I think it's still going to be under the umbrella because right now we do have basically physician assistants that help us read all our X-rays. So with the AI, maybe they can help us read the CAT scans, the MRIs. So, like I said, the volumes are just out of control. So there's no way, with the number of radiologists that are in America right now, it's too hard to even keep up with the amount of imaging we're doing, and it's just getting more and more and more and more. I mean, basically, anytime anyone goes to the emergency room, unless it's just a cut and you're getting a stitch, even with cuts, sometimes they'll just take an X-ray to make sure there's not a foreign body in there or something like that. But everybody gets some sort of imaging if you enter the hospital. So, I think it's going to help. But I think everything is just going to kind of be under the umbrella. I don't know. I can't think of any new job opportunities that might come out of this.
So kind of along the same line of questioning of like things changing, obviously like the medical field is changing every day, but is really different following kind of COVID and even as like the political climate changes, like the medicine changes. So I guess what do you want to see right now, like in the world of healthcare, in radiology? Like what changes do you think need to be made kind of as we evolve?
That's a good question. Changes, yeah, and I'm not 100% sure. I mean, obviously, with healthcare and people getting access to care, obviously there needs to be changes, but I'm not really too involved in that type of stuff. I pretty much, we don't really handle our billing and our insurance. I know we do sometimes get into situations where someone's insurance provider will deny a procedure where we feel that it's necessary. So we have to get on the phone with the insurance company and kind of plead our case as to why we feel the patient needs this procedure. And again, there's a limitation on the amount of time that we have during the day. It's like, well, do we want to be on the phone with these insurance companies or do we want to be treating patients? It's like there needs to be some sort of balance. But I can understand why they do that because I mean it's a for-profit system for them, so they're trying to save their money. They don't want to just be paying out for everyone to get every procedure. So it's a hard type of thing, but it's not something that I'm really involved with myself, and I don't really have too many opinions on it because I'm not really educated on it as much as I probably should be. I'm kind of a workhorse. I read my CAT scans, I read my X-rays, I do my procedures, and I go home, I kiss my wife, I hug my baby, and I go to sleep. That's pretty much how I operate. So I haven't really delved into all that.
And this is kind of similar, but what like type of people or skills do you think healthcare needs? And do you have any words of advice for students considering a job in healthcare that you wish someone could have told you?
I mean, in healthcare, it's always you want people that are kind, compassionate, knowledgeable, or willing to work hard. You definitely don't want those type of people that want to cut corners, because cutting corners, it's affecting someone's life. You know, in terms of advice, if it's something that you love, and it's not just medicine, I feel like in general, the career you pick has to be something you like. It's like your career is pretty much your life, essentially. You guys are in school right now, but after college, when you get into work, basically you're going to be waking up, you're going to be going to work, and then you come home, you hang out with your family, and then the next day is work again. So if you don't like the job that you're in, life's not going to be fun for you. So you really got to figure out what you're good at, what you like, and really pursue that. Don't just go into something because someone tells you, oh, you're going to make good money in this. This is a good field. Because if you don't like it, who cares? You could have all the money in the world. I mean, you only have one life to live. You want to be happy at the end of the day. So, I mean, are you going to be happy with more money but hating your job that you have to do every day, day in, day out, or less money and just loving what you do? I mean, I think the answer is obvious there.
And I guess kind of along those same lines, like looking back on your life, obviously, like you seem to love what you do and it seems very rewarding for you. So I guess since our podcast is kind of geared towards, college students, high school students, if you could go back in time to being a senior in high school, can you tell us one thing that you would tell yourself? And kind of, would you do everything that you did all over again? Would you change anything?
Yeah. So one senior year of high school, I remember those days, great times. Um, yeah, I mean, I would tell myself that because when you're in school, sometimes it can get a little, it's like your friends are doing things and you got to study or you can't make it to the party or you can't take a trip that everyone's taking, and sometimes it would bum me out. But you just got to tell yourself, look, it doesn't matter. You're gonna have your whole life to do all these things. You should really be focused on, building yourself, into a good person and having a nice career. Because again, like I said, that's going to be pretty much the crux of what you do throughout your life. So, don't worry about missing, those events or hanging out with your friends. I mean, try to do as much as you can, but if you miss something here and there, it's not a big deal. And just work as hard as you can. This is, you only got a few years to do it. College and your post-college, try to dedicate 8 good years of just kind of building yourself into the best person you can be.
Yes, that's an amazing answer. I think that's great that it also definitely transcends the medical field. But I think that was all of our questions that we had today. Thank you so much. This was very insightful.
Oh yeah, it was great talking to you guys.
Thank you so much. It was so nice to meet you.
Absolutely. Nice to meet you guys too. Good luck with everything.
Thank you so
you.
much. Have a great rest of your day.
You too. Bye-bye.
Bye.